I'm about to show you something that might genuinely shock you. And if you are 60 or older, you need to hear every word of what I'm about to say. Your body is giving you 10 specific warning signs that your cholesterol is dangerously high. Not vague signs, not maybe perhaps signs. 10 specific measurable signals your body is sending you right now, and most people completely ignore them. Not your annual blood work alone, not a pill, not a diet fad, your own body. And I'm going to walk you through all 10, one by one, right now. My name is Dr. Frank Briggs. I spent 20 years as a family physician before I retired at 67. In those 2 decades, I sat across the desk from thousands of patients who had no idea their cholesterol was silently destroying their arteries until it was almost too late. Stay with me through all 10 signs, because sign number 10, which I'm saving for last, is the one that most doctors never connect to cholesterol, and it's the most important one I'm going to share with you today. If you are between 60 and 85 years old, this video was made specifically for you. Here's why. After age 60, your liver changes the way it processes cholesterol. Your arteries are less elastic. The margin for error becomes much smaller. What was a borderline number at 45 can be a cardiac event waiting to happen at 70. So what exactly is high cholesterol? Let me make this simple and clear. Cholesterol is a waxy, fat-like substance that your body actually needs to build cells, make hormones, and digest food. The problem is not cholesterol itself, it's when you have too much of the wrong kind circulating in your blood. Think of your arteries like the plumbing in your house. Now imagine slowly pouring thick grease down those pipes every day for years. Over time, that grease builds up on the walls. The pipes narrow. Water pressure rises. Eventually, a pipe bursts. That burst pipe in your body is a heart attack or a stroke. There are 2 key numbers your doctor watches: LDL, the so-called bad cholesterol, and HDL, the so-called good cholesterol. When your LDL climbs too high, it deposits plaque inside your artery walls. That plaque hardens, arteries narrow, blood flow to your heart, your brain, your legs, all of it becomes restricted. According to the American Heart Association, nearly half of American adults have cholesterol numbers in the unhealthy range. And here's the terrifying part. For 2 out of every 3 of those people, the first symptom they ever notice is a heart attack or a stroke. That is exactly why these 10 warning signs matter so much. I'm going to give you all 10 signs in a moment, but first I want to tell you about Dorothy, because her story changed the way I practice medicine. Dorothy Leone came to see me at 70 years old. She was active. She walked 3 miles a day. She'd been on a low-fat diet for 15 years, exactly what her previous doctor had told her. Her annual checkups said her cholesterol was borderline. Her doctor told her to keep watching it. But Dorothy had been noticing things. A faint yellowish patch forming near her left eye, occasional chest tightness when she climbed stairs. Her feet felt cold, even in summer. She mentioned these things to her doctor. He told her it was probably just aging. 6 months after I first met Dorothy, she had a mild heart attack. When we ran a full lipid panel, including LDL particle size, which most standard tests miss, her small, dense LDL particles were through the roof. Her standard LDL number looked manageable, but the deeper picture was catastrophic. The signs had all been there: the yellowish eye patches, the cold feet, the chest tightness. Her body had been screaming at her for 2 years. Nobody told her what to listen for. Today, Dorothy is 73. She is thriving, but she will always carry the memory of that hospital room. And every time I record a video like this one, I think of Dorothy, because you, watching this right now, might be where she was 2 years before her heart attack. All right, let's get into it. 10 warning signs that your cholesterol is dangerously high. Check your own body as we go through each one. Sign number 1, yellowish bumps or patches on your skin, xanthomas. Here's the thing, cholesterol doesn't just circulate in your blood. When levels get high enough, it starts depositing in your soft tissues. These deposits appear as small, raised yellowish bumps on your elbows, knees, ankles, knuckles, or buttocks. They're called xanthomas, and they are a direct, visible sign that your LDL is overloaded. You can see them, you can touch them. Your body is literally showing you its cholesterol problem. If you have noticed any unusual yellowish bumps on your skin, do not ignore them. Sign number 2, yellow patches around your eyes, xanthelasma. This was Dorothy's sign, the one nobody connected. Soft, flat, yellowish patches that form near the inner corners of your eyelids. They're called xanthelasma. A 2017 study published in the British Medical Journal found that people with xanthelasma had a significantly elevated risk of heart attack within the following decade. These patches are not cosmetic. They are your body depositing excess cholesterol directly under the skin of your face. If you look in the mirror and see yellowish patches near your eyes, take note. That is your body waving a red flag. Right now, pause for a second. Drop your last total cholesterol reading in the comments below. If you've never had it checked, type "never checked." I read every comment and I want to see where this community stands. Sign number 3, a white or gray ring around your iris. Look closely at your eyes in good lighting. Do you see a faint white or gray ring forming around the outer edge of your colored iris? This is called a corneal arcus, and in people under 60, it's a serious warning sign of high cholesterol. In people over 60, it becomes more common, but it still correlates with elevated LDL. The ring forms when cholesterol deposits accumulate in the cornea. It's painless. It doesn't affect your vision, so most people never mention it to their doctor. Mention it. Sign number 4, chest tightness, pressure, or pain. When your coronary arteries, the vessels feeding your heart muscle, begin to narrow from cholesterol plaque, your heart starts sending distress signals. You might feel a squeezing pressure in the center of your chest, especially when you climb stairs, carry groceries, or get stressed. It might last a few minutes and then fade. Doctors call this angina. I'm telling you, do not rationalize this away as indigestion or muscle strain. In your 60s and 70s, new chest discomfort is a cardiovascular emergency until proven otherwise. If you notice this, speak to your physician that week, not next month. Sign number 5, shortness of breath with light activity. You used to walk up a flight of stairs without thinking about it. Now you're winded. What's happening here is that narrowed arteries reduce the oxygen supply to your heart muscle. Your heart has to work harder for the same output. The result is that activities requiring modest exertion suddenly leave you breathless. This is your heart telling you it's struggling. Many seniors attribute this to just getting older. I heard that in my practice constantly. But I'll tell you what I told every patient. Getting older doesn't explain new breathlessness that wasn't there 2 years ago. Cholesterol-related artery disease does. Sign number 6, persistent fatigue and low energy. When blood flow is compromised by arterial plaque, your organs, including your muscles, receive less oxygen. The result is a deep, persistent tiredness that sleep doesn't fix. You'd be surprised how many patients came to me describing fatigue they'd written off as depression, thyroid issues, or simply aging, only to discover their arteries were operating at a fraction of their designed capacity.
If your energy has declined noticeably over the past 1 to 2 years and no other cause has been found, have a full lipid panel run, including LDL particle size, not just standard LDL. Here is something that genuinely disturbs me, and I don't understand why it isn't the first thing every doctor tells their patients. Your standard cholesterol test can tell you your total LDL number and give you a false sense of security. But what most physicians don't measure, unless you ask specifically, is LDL particle size. Large, fluffy LDL particles? Relatively harmless. They bounce off artery walls. Small, dense LDL particles? These are the ones that burrow into artery walls like splinters. They trigger inflammation. They are the particles that cause plaque to grow. Dorothy's standard LDL looked manageable, but her small, dense LDL particle count was dangerously high. A test called an NMR lipoprofile measures this. It costs under $100. Most standard physicals don't include it. So if your doctor says your cholesterol is fine, ask for an LDL particle size test. What you don't know absolutely can hurt you. Sign number 7. Cold, numb, or painful legs and feet. Your legs and feet are at the end of your body's circulatory highway. When cholesterol plaque narrows your peripheral arteries, the ones running to your lower limbs, the reduced blood flow causes coldness, numbness, cramping, or aching pain, especially when you walk. This condition is called peripheral artery disease, and it is directly caused by the same cholesterol plaque process that attacks your coronary arteries. Think of it as a preview of what's happening closer to your heart. If your feet are chronically cold, if your calves cramp when you walk a few blocks, please do not dismiss this as just circulation. It is a sign worth investigating. How many of these 7 signs have you noticed in your own body? Type the number in the comments. Even if it's 0, I want to know. Your answer might help someone else watching this video realize they need to take action.
Sign number 8. Erectile dysfunction for men. This is one most men are too embarrassed to mention, and most doctors are too rushed to ask about. But the research is unambiguous. Erectile dysfunction in men over 60 is, in many cases, an early warning sign of cardiovascular disease. Why? Because the blood vessels supplying that area are among the smallest in the body, and small vessels are the first to be affected by cholesterol plaque. A 2010 study in the journal Circulation found that ED often precedes a cardiac event by 3 to 5 years. If this is something you or your partner has noticed, it is worth a candid conversation with your doctor about your cardiovascular health, not just a prescription for a symptom. Sign number 9. Memory problems and brain fog. The brain receives approximately 20% of your heart's entire blood output. When the carotid arteries, the large vessels in your neck that feed your brain, accumulate cholesterol plaque, cerebral blood flow decreases. The result is cognitive sluggishness, difficulty finding words, struggling to concentrate, forgetting names you've known for years. Now, I know what you're thinking. That's just aging. Sometimes it is, but a study published in the journal Neurology found that high LDL levels in midlife were associated with a significantly elevated risk of cognitive decline later. When was the last time you had your cholesterol checked alongside your cognitive complaints? Sign number 10. High blood pressure, the hidden cholesterol connection. I saved this for last, and I meant what I said in the beginning. This is the most important sign I'm sharing today, and it is the one most doctors fail to connect. Most people think of high blood pressure and high cholesterol as two separate problems. They are not. They are two faces of the same disease process. Here's what's actually happening. As cholesterol plaque builds up inside your artery walls, the arteries stiffen and narrow.
Your heart now has to pump harder to push blood through those narrowed channels. Think of trying to force water through a partially kinked garden hose. The pressure builds because the passage is restricted. The result is elevated blood pressure. So when your doctor tells you that your blood pressure is creeping up, 130/85, 140/90, 150/95, and they prescribe a blood pressure medication without checking your LDL particle size and your arterial health, they may be treating the symptom while the root cause continues unaddressed. If you have been told your blood pressure is elevated, I want you to hear this clearly. That elevated pressure may be your arteries clogged with cholesterol, struggling to move your blood. High blood pressure and high cholesterol must be managed together, not in separate conversations. Ask your doctor this exact question at your next visit. Could my blood pressure be elevated because of arterial plaque from cholesterol? Watch how that conversation changes.
All right, here is your action plan. I call it the 5-step cholesterol awareness protocol. Write this down. Step 1. Schedule a full lipid panel in the next 30 days. Request LDL particle size testing specifically. Ask for an NMR lipo profile or equivalent. Step 2. Record your blood pressure every morning for 14 consecutive days using a home cuff. Bring those readings to your doctor. Patterns matter more than single readings. Step 3. Stand in front of a mirror in good light and examine the skin around your eyes, your elbows, and your knuckles for any yellowish deposits or patches. Step 4. Keep a 1-week energy and symptom diary. Note any chest tightness, unusual breathlessness, cold feet, or cognitive fog. Dates and details matter. Step 5. Have an honest conversation with your physician about everything you've noticed, including the symptoms you've been rationalizing away for years. Now, I know what some of you are already thinking. Let me address the 3 objections I hear most often. Objection 1. My doctor said my numbers are fine. I hear this constantly. Ask your doctor specifically about your LDL particle size, not just your total LDL. Standard panels miss the most dangerous kind of cholesterol. Fine on paper is not the same as fine in your arteries. Objection 2. I feel perfectly fine, so I can't have a problem. This is the most dangerous myth in cardiovascular medicine. High cholesterol produces no pain, no discomfort, nothing, until it does, and by then you are often in an emergency room. Feeling well is not the same as being well at the arterial level. Objection 3. Cholesterol medication has too many side effects. I'd rather manage it naturally. I respect this, and there are absolutely dietary and lifestyle strategies that move cholesterol in the right direction, but those strategies require time, and your arteries do not wait. Have the conversation with your doctor about all your options, including pharmaceutical ones. You are entitled to a full picture, not just one lane. I want to end with something important. You are not broken. Your body is not failing you. Your body is communicating with you through every one of the 10 signs we walked through today. It has been communicating with you. The problem was never your body. The problem was that nobody taught you the language. Dorothy was not weak. She was not careless. She was simply not given the information she needed in time. You now have that information. You walked into this video not knowing what to look for. You're leaving it knowing 10 specific signs, signs that could give you years of advance warning that other people never get. That is not a small thing. That is the difference between a life interrupted and a life extended. You are capable of taking action on this. You are capable of having a different, more informed conversation with your physician. You are capable of recognizing what your body has been trying to tell you. The information is yours now. Use it.
If this video helped you, if even one of these 10 signs made you stop and think, please hit the like button right now. It takes 1 second, and it tells YouTube to show this video to more seniors who may be in the same position you were in before you pressed play. And if you are not yet subscribed to this channel, subscribe today. Every week, I bring you the kind of clinical clarity that I wish I could have given every patient I ever sat across from, for free. No appointments, no waiting rooms. I'll see you in the next video. Take care of yourselves.